Today in Health IT, we have another interview from the CHIME Fall Forum. And what we did was a set of interviews in action, which we are really excited about, and I'm looking forward to sharing with you. My name is Bill Russell. I'm a former CIO for a 16-hospital system and creator of This Week in Health IT, a channel dedicated to keeping health IT staff current and engaged. Again, as I said, got a great opportunity to go to San Diego, visit with some CIOs and the people that make the magic happen in healthcare and healthcare IT. And here's another one of these great interviews. All right, we're at the CHIME conference in San Diego. We're doing another interview from the floor. We have Donna Roach, who is the CIO for University of Utah Health.
Yes.
It's great to see you again.
Thanks.
We actually ran into each other at BJC. So you used to be at BJC?
Yes, yeah, BJC and Washington University Medical School.
Wow.
So,
what did you do there?
I was the vice president over Epic. So one instance of Epic over two different tax ID'd companies. Very interesting.
Two different tax ID'd companies. That's an interesting dynamic.
Yeah.
I was going to say over Epic at any academic medical center is a big job.
It is. Different competing priorities definitely go on, and you have to balance a lot of different personalities. You have a lot of different bosses.
And you have that disarming smile, like that's a great idea.
That's a great idea. I like that.
Let's run that through governance. Let's see how that goes. And governance is really important in a place like that.
It is definitely in academics. That's one thing that has surprised me is how much is committee run. And I love something that Churro Goswami up at UW said. It's not committee, you want to workshop, and you want to work. And I'm like, I'm going to use that. That was a really good way to think about it.
So you're now CIO, University of Utah.
Yep, hospital and clinics.
Academic Medical Center,
yes.
I assume?
Yes.
Headquartered in Salt Lake?
Salt Lake City. Mm-hmm.
Okay, but you have a larger area than that.
Yes, we are a 5-state quaternary referral to the University of Utah. We are the only academic facility in that 5-state area. So.
And between you and Intermountain probably have, what, 90% market share?
Yeah, HCA Stewart. We're kind of those three are the big players in Utah.
That's what we find in most major metros is you have 3 players. Mm-hmm. And a lot of times it's not, an even split, but they're at scale.
Yeah, and we're the academics, so we're state.
And so you have to work with everybody.
That's right.
Are you the Children's Hospital as well? Or?
So the Children's Hospital is a relationship with Intermountain. It is their facility, their EHR, but our physicians.
Okay, that's interesting.
Yeah.
As much as I'd like to explore that, I'm not sure my audience would be really excited about that. But I do want to talk about, like, what's top of mind? What are you thinking about these days?
A lot is digital roadmap. So when I got there, I was asked to take what they had in terms of digital and really
All right, so
run
before we
with
go
it.
there, when did you get there?
A year ago. October 5th was my anniversary date.
So you were what, 6 to 7 months into COVID at that point? And really, they wanted to focus on digital at that point? So
yes.
So you really had responded to the pandemic, you had some things in place, and you were ready to go.
Well, they were like any academic or any hospital. We went from 0 to close to, I think, 40,000 telehealth visits in a month. The curve that we experienced, now we've settled off, we're about 20,000 a month, and inpatient ambulatory visits have picked back up. So what we're seeing in telehealth is just an add-on to our in-person ambulatory visits.
Oh, interesting. All right, so digital. You come in October and they're like, all right, we have this digital roadmap. Mm-hmm. We now, I'm putting words in their mouth, we now recognize how important digital is, especially in the age of the pandemic, because we need to reach people in a lot of different ways than we used to before. So what did it look like to sort of, I assume you picked something up that was already existing. Where do you start to ideate? Do you go back into the organization? Do you bring in outside people to look at it? I mean, what's the process?
Actually it was kind of funny. Probably week 1 I got there and they said, we have this digital strategy. We want you to run with it and partner with the CMIO, who's great, absolutely wonderful, Dr. Hightower. And I said, well, tell me digital strategy. You have something, tell me what that is. And they're like, well, it's our virtual telehealth program. I said, you do know it's more than that. Like we want to grow that bigger than just that one space. So they're like, well, do that.
Go
ahead.
Go. Get that done.
Maya, Dr. Hightower and I worked together. We actually did a couple things right up front. We brought in impact advisors to help us with the initial, how do we start to assess the environment? Where are we? What does governance start to look like? How do we create the charter? So in that first year, we pulled together a charter. We pulled together what we call our Digital Enablement Committee. We looked at early on what should be on our roadmap. So we have like 3 key things on our roadmap, but we also went back and said, at the same time, the 2025 strategy refresh was being done by Dr. Good, who's the head of the medical school and kind of my boss's boss. And he had directed steps. So every year there's a group of directed steps. So we went and looked at there were like 60 some directed steps for 2021. We looked at that, we said there's about 30 digitally enabled strategies in there. We talked to each of those, and then we are starting to now put that back on the roadmap using our DEC committee to help in the prioritization of where those should fit.
Intermountain is a strong digital company.
Yes.
They're also operating at margins because I go to the JP Morgan conference, they report out their margins, and I look at those and I go, they have to be the envy of just about every health system across the country. So they have a fair amount of money to spend. Is there any sort of looking out of the corner of your eye going, what are they doing over there? Or do you just try to focus in on your specific community?
So it's good to know what they're doing. Ryan and I, who's the CIO, we partner quite a bit, and I don't see them as a competitor, especially in the IT space. I think we have to partner, and we have to be coming to the community and to different vendors in the same way. And so we're doing that partnership together.
There's sort of that expectation in the community. If I lived in Salt Lake, I would expect that the university and Intermountain would work together.
Yes. Absolutely.
And the neat thing is, I think I could see you and Ryan working together. I mean, you're 2 very reasonable people, very smart, and have probably really good teams. I haven't met your teams, but I've interviewed some of Ryan's teams over the years, and they're really some of the top people in the industry on this stuff. You could probably get a lot done just at that level, I would think.
Yeah, and just take one space. So AT&T with the FirstNet rollout of the first responder network. It's much easier for us to go together and talk to FirstNet and AT&T as a group rather than me going and him going. Now, he's got a lot more power and probably could get them to move on it, but us together and then showing the legislature that we're working together is huge.
What about like vaccination programs? That came at probably that would have come right after you got there.
Yeah. So vaccine in the state of Utah was kind of interesting. It was managed by the Department of Health within Utah. It wasn't necessarily managed by the academics. So the state would give us vaccines, and we had to show, especially for us, we had to show 85% vaccination rate before they would give us more vaccine. So we actually didn't necessarily vaccinate the largest percentage. The largest percentage of vaccinations came from the state.
It's interesting because my vaccination was drive through a park, and it was paramedics, but essentially the card was filled out by the state health department.
Yeah. The beauty of it, though, is when people were having it done at Utah Health, if you had a MyChart record, it automatically it's populated in, and some of those with a clear pass and everything now, that's all kind of being integrated. It's nice.
I mean, I could pull up my phone right now and show you my vaccination on ClearPass because I went to the health conference and it was required. And it's interesting, the next conference I go to, they're like, hey, bring your card. And I'm like, I brought my card. I don't want to keep bringing my card because that card's kind of...
Yeah, it'll wear down.
It'll wear down. And I wanted to know if can I just show you this on my phone? And they're like, we'd rather see your card. And I'm like, that is such a healthcare thing to say.
Yeah.
I'd rather see your card.
Yeah.
Have you seen things progress? We started using chatbots. We started doing, telehealth isn't new, but we started to
Right.
maybe integrate it in different ways and stuff. Have you started, what are some of the things that maybe you started during the pandemic that you think will have a life?
I think definitely with the vaccine process, us looking at how well we did, especially in the equity piece of it, was really telltale. We did a great job for the Caucasian population, but when you looked at Hispanics, African Americans, Native Indians, we didn't do such a good job. And the beauty of the University of Utah is that they're willing to look at it and say, we need to do better and be more equitable. And so really put some programs in place. So they're when it comes to data, they're very transparent. You could go out there now and look at some of the data points that I'm talking about. And it's out there, and it really is open to the public to kind of see how well we do.
Yeah, we say Salt Lake, but I mean, Utah is Salt Lake, Provo, and a bunch of really neat towns, but they're towns,
Jordan,
and there's a lot of space in between those. Are you servicing those areas as well?
We do. We are pretty much the entire state of Utah, and then a lot of those 5 state regions that don't have academic facilities. We have a fairly extensive Connect program where we send physicians out to other smaller regional hospitals to help with kind of connecting or doing programs. We also have a really pretty cool program. I think it's Encore or Core. Forget the name. I get the name mixed up. But where we help train and do actually kind of virtual training programs for physicians in other markets that wouldn't have any
Virtual
access
training. That's interesting.
to that kind of training.
I did talk to a company that was doing all this work in ORs, where they're actually watching surgeries and that kind of stuff, and they're training people from afar and doing that. And I thought, this is going to be interesting for rural health. I mean, right now, I think we're sort of resigned to the fact that if you need a major surgery, you're driving to Salt Lake. But the rural health stuff has me fascinated. I didn't have that problem per se in the markets that I served, but it's such a multifaceted problem. The technology maybe isn't up to speed. You don't have the connectivity, the accessibility to doctors, trained medical staff is not there.
Right.
Is that something that you guys have groups looking at and they're bringing technology into?
Yeah, so take our orthopedic hospital and our Craig T. Nielsen rehab. Craig T. Nielsen is state of the art. So whenever you come out to Salt Lake, you got to come and you got to see this, because it opened, I feel bad for them. They opened right at the start of the pandemic. So they had their 1-year anniversary. It was smack in the middle of it. But what they do, awesome services to the point where when a patient comes into the room, they can actually control all of the devices in the room by breath if needed, if they have no capacity in their arms. Or the facility itself is almost set up like it looks like a hotel. And you know what rehab hospitals can sometimes look like, or they're not necessarily the prettiest. This is very much state of the art, the programs, the services, and what they're doing. The counterpart, the rehab facility just down the street, they do surgeries and train residents and medical students on surgeries. They kind of project the surgeries. And I got to do a tour of it, and I'm kind of a geeky person. They're like, "You want to see the cadavers?" And I'm like, "You bet." I'm sure they thought, well, let's freak out the IT person. And I'm like, no, I love, but they actually take a cadaver bone, they recreate it with a 3D printer, and then they show and train the residents on how do I place this pin in this cadaver bone. They're projecting, the whole surgery. Medical students can kind of be part of this because it's just a cadaver bone that's been recreated, but it helps in the training process of those kind of procedures.
That is so
It is.
Cool. Man, it must be such a fun job, because there's so many aspects to it that you get to play with.
Yeah.
Donna, thank you for stopping in.
Bill.
Really appreciate it.
Yeah, this is great. Thanks.
There you have it. Hope you enjoyed it. We did 10 of these interviews at the Chime Fall Forum. Hope you check back for some of those other interviews to catch what the industry insiders are saying about healthcare IT.